endless possibilities. HPV and I sense low risk HPV.
Yes, right.
It's high risk HPV may cause cervical cancer. And also you are baby. You were type 16 you were type 18 you were type 45. Different type high risk.
Okay.
And I low risk. Low risk no cause genital warts. Me need to make kind of that.
Okay.
Genital warts no. I can say it's a cauliflower tea. It's me bobo mass use you be able to say cauliflower. So it can be managed and treated.
Okay.
So that's for the low risk.
Okay.
But like I say, cervical cancer, just know that it's high risk HPV are persisting when body.
Okay.
So that is the brief explanation we can give about cervical cancer.
Okay. When you now cancer, so we know infection now it's what was and then now me person we sense to my review. So we because the causes of cervical cancer no. Na edeba.
Okay, so the main cause is the high risk HPV.
Okay.
So when we talk about cervical cancer, about 99.7% of cervical cancers are caused by high risk HPV. That's the human papilloma virus. That's the cause of it. Okay. But we have situations where there are risk factors. You know, people that there are risk factors. Yeah. And then the fact that how the HPV can also be transmitted, the mode of transmission. So
yes.
So when we talk about the risk factors, one, we can have people who have multiple sexual partners. You know, virus now, the person can easily transmit to another person. Okay. And then another person also gets in it, and then no, they are more before. No, being so they are more before. That's what I say. So multiple sexual partners, or who are sexual partners, who do be brave, or fahase, no afahase. The transmission is very easy. And then two, we also have early sex.
Okay, so obi
some people by age 12, 13 no are starting. So it exposes the cervix to the infection.
Okay.
Into HPV ne ba one man kwan obetumi thrive in your cervix.
Okay.
So early sex too is also a risk factor. And then those who smoking.
Okay. So obi share. It's also because there's a substance when my friend nicotine. Yeah. Nicotine will suppress your immune system now bafem. Into infection yours will stay. Okay. Because your body is not strong enough to clear the infection. Yeah. So it will persist in your body and then it will later cause cervical cancer. And I will be also recurrent sexually transmitted diseases. Okay. Impema goyari and anyesa. Yes. To say gonorrhea, syphilis. Ebimu wa hospital for the doctor to see them, know the type of sexually transmitted infections they have, and then for it to be treated properly. So when it becomes recurrent, every time you are treating it, cervix no epithelium so that protects it. So you are just clearing epithelium everything. Cervix never trying. Okay.
So you are breaching that epithelium and you are giving the HPV say okay, you can have access to the cervix. So you have to go and then make sure that you are being treated properly. Okay. So that infection and then we also have pregnancy. Okay. Pregnancy is also an immunosuppressive state. Yes. When you become pregnant, your immune system is not as strong as someone who isn't. It's like your immune system now above them to some extent. Yes. So it's like your immune system man a chance and recover at a point in time. So all the time your immune system is down and you are giving ways and means for this HPV to stay in your system. Okay. Yes. And then we also have the people who have immunosuppressive states. Okay. Yes. You can't immunosuppressive state. The immune system now above them to the extent that infection is bad. And to me, ain't clear that easily.
Okay.
So such people,
okay.
So example of such people are those with the HIV, the human immune virus.
Okay.
These people have about 5 to 6 times higher chances of getting the cervical cancer. Yes. So with such, we entreat them to take their medication so that it will boost your viral load, such that their immune system will be able to fight the infection.
Yeah.
Yes. So these are some of the risk factors. Yes. That the person will be prone to say HPV infection.
That is the main mode of transmission, through sexual intercourse.
Yeah, but mode of transmission
okay.
But Rebecca said was sexual and non-sexual means.
Okay.
Sexual means in Pemagro you can easily get it. A bit more so use sex toys.
Oh.
Yes.
Okay.
So you can transmit the HPV onto these toys. And then when you don't care for them properly and you reuse them, you can easily get it.
Okay.
So these are and with the non-sexual means so you were horizontal and I were vertical.
Okay.
A vertical now a mother can give it to a baby. Through birth.
Oh.
A mother can give it to a baby. A baby respiratory papillomatosis. That's where the child has hoarseness in his voice. Once in a voice, and yeah, as clear as the normal
voice, the human voice.
And then with the the horizontal, so handshake. Right now we are talking about the virus, the HPV virus.
Yes.
So shake your binsa. You don't know
when you be.
No, the virus okay. Then you shake the person.
Okay.
So we encourage proper hand washing. WCs na the toilet seats. You can also easily be infected.
Wow.
The enema bulb syringe bentwa.
Okay. Ne both you know.
That's right. And they use use one for about 5 people. Good. It's not advisable. It's not safe. So you can also get the HPV virus, at that stage. And then our undergarments, your panties, we should also wash them well, so that the virus ain't transmitted easily to the individual. And I not say virus now cause cervical cancer. No, the cancer itself would do a stage now. There is nothing that can be done.
I didn't know cancer.
So we do that stage,
Okay.
We do cancer stage now. It's just palliative care that is being given to you till whatever that happens. So before that, we be pre-cancerous cells.
Okay.
And better than cancer. No. We can treat that. We can manage that. But the moment it gets to cancer stage now, it's like you have run out of options. Okay. And see, that is the mode of transmission and risk factors.
Now, my confused kakra with the sexually transmitted one. Meaning say MMA or muni cervix.
Okay.
How does the virus thrive in them matches on bit mediama oba amanenya a cancer in the long run?
Okay, so you can't HPV HPV no.
Okay.
And a human papilloma virus no.
Okay.
It's multicentric. It's me causing enyama bebre. With the female, it's me causing vulval cancer.
Okay.
It's me causing vaginal cancer. It's me causing cervical cancer
or
anal cancer.
Okay.
So it would be with them. Until unishia, then he transmits it to you. But
now, young call symptoms.
Okay.
So obina cervical cancer ibia. Then so ben essentially ben a bed dead yami nipa when ya cervical cancer.
Okay, so symptoms no, were from the early stage to the advanced stage.
Okay.
Yes. So you will be able to say abnormal bleeding. Don't say too.
intermenstrual bleeding, women's cinema, you know, when you cramp now, you realize that you are still bleeding, which you don't know the cause. Ebimun so omoye mpema go where they bleed. If any postcoital bleeding,
okay,
it's also one of the symptoms that occurs. And your lower abdominal pains. Ebimu omayase omoya your extreme weight loss.
Even when they are not menstruating.
Yes.
Okay.
Your extreme weight loss. Obimu say wafon. That is when you know cancer stage has set in.
Okay.
And then we also have anemia. So far as you are bleeding, you are bringing out a lot of clots, you are at risk of being anemic. Now age being a coffin.
Okay.
And then we also have, say, offensive vaginal discharge.
Okay.
Very offensive. Yeah, so those are some of the signs and symptoms.
Okay.
Into
no, yet was no, non person who say, Obi, a bit me abon who by a free, a cervical cancer in one. A dear no was away.
Okay, so that's prevention.
Yes.
What the person can do. So with the prevention, you were primary prevention. Initial stages, and then we have the secondary prevention.
Okay.
So with the primary prevention, we are looking at the fact that in maybe what we can do so that you won't get the HPV in the first place, the infection. And a secondary, say measures that we are putting in place such that say HPV no, be aware HPV no, but it will not advance to cervical cancer. Okay. Like I said, say cervical cancer, we don't treat it, but the malignant cells, or the pre-cancerous cells, when you come, we do that. So with the primary prevention, there was education, education on lifestyle modification, especially with the sexual lifestyle.
Okay.
So in the prevention one, you abstain from sex. You know the ABCs. You be faithful to your partners.
Okay.
And then you also use condoms.
Okay.
You know, when you know correctly and properly, correct way of using the condom. And now with the first sex too, you make sure that you delay it so that you don't expose this service too much to the good. Into the delay sex, you delay your first sexual encounters so that at that stage, you know, say you are good to go. So that's for the
early stage,
early stages, you know, the prevention, the primary stage, you know. Apart from the education, we say be more what they do. You can say do cha. Be more what nase no or seminar the run nase.
Okay.
Or we are or inkua or the fan
spray or the
a whole lot. But for fun douching, you avoid it.
Okay.
That is not safe. And you make sure say. In case unya mpema go yari, you make sure you go to the hospital, so that you'll be seen, assessed. Now, whatever treatment they have to give to you, you'll be treated properly.
Okay.
Now, when you're treated properly, I believe that you'll be coming for reviews. Now, Dr. Nashel. Now, if you are free from it, you'll be told you are free from it. And then you also abstain from sex or you use the condom. So aside the lifestyle modification, you were vaccination.
Okay.
We are recently na vaccines no not but for public exposure no, we have vaccination.
Okay.
Now vaccination also in medical can say HPV you were high risk ahodo bebre.
Sir.
So even after a successful vaccination, you still have to screen yourself. Come to the hospital for you to be screened.
Okay.
Because any vaccine any HPV high risk na protect you against.
Oh, okay.
Into one of the vaccines there was Cervical
There's a vaccine for
Ahodo.
Okay.
There was Cervical Into no is over the first sector. The following month, no wabeji another one, and then after 6 months, no wabeji. Into that one protects against HPV high risk type 16 and 18.
Okay.
That's for the Cervical. You will gather so 4 and also protect against HPV high risk type 16 and 18.
Okay.
And a low risk no so you can say it causes genital warts. Into low risk no so a bonne hobine.
Okay.
And
and I will gather so 9 so ewo ho. Inti eno protects against about 7 high risk HPVs and then 2 low risk. Inti vaccines they are would be but even when you are giving the vaccine, I was so uber for screening. That is where we come to the secondary prevention.
Okay.
So with the secondary prevention, ebiana nipa no ewo HPV no. So you come for you to be screened. Ubabani is screening so that in case or should you have HPV virus now, should you have the lesions, the precancerous lesions, it will not develop to any yet to me so in time. Because the cervical cancer no, it can stay with you 10 to 15 years without any symptoms. Without any symptoms.
Not
at all.
Wow.
Unless you are screened.
Okay.
Unless you Uber hospital now, then we screen you, then we know what is going on. But physically, no. Not at all. So it will be with you 10 years, 15 years. Until before you see the symptoms, just know that you are in your, a drusa stage, your cancer stage. So since we can't tell physically, emotionally, there is nothing that will show. Bibia entry.
Wow.
Into Uba hospital now. Near screening, you was screening methods who do be until you are screened, we cannot tell anything.
Okay.
There is nothing that can be done with regards to we noticing it. So when you come for the screening, and you say you are coming now, you say a cancer derby. Until we are coming to screen you for the possible risk of you getting the HPV.
Okay.
So that our home poor it will not get to, we will manage it such that pray and cause that good to that cancer stage.
Okay.
So that's the reason why we encourage regular screening.
Okay.
So that we can be able to, the precancerous cells, the pre-malignant cells, so that we can be able to treat and manage them. But a banner say it advances to the cervical cancer stage, and the symptoms will begin to show. That is why we encourage the screening. To screen and know your screenings are who do baby Ebimu one your VIA, a funny visual inspection with acetic acid.
Okay.
Yes. So by apply acetic acid on wawodiya nano. Ni I say changes be.
Okay.
Pap smear so ba you take a sample wawodiya no ano na ye de call lab. It's lab na say okay ebi wo ho ebi ni ho ebi so wo ho what can we do? And a third one also molecular testing commonly one HPV DNA testing and also ho. It's when so oba the same thing you first sample if you awodiya nano na ye de call lab. So the outcome of the results will tell us the treatments that we can also give to you.
For let's just say regular checkups there, and we hear me escape you. We had then I was a brainy no onco hospital once in a month, twice in a month. Let's say after every 2 months, onco hospital say, oh doctor, my ba mo shosha mapomudi and mami na mo shosha mini pedio mamia ebeboa. It's as a HPV virus I can was cervical cancer. So say in yasha say ni pedio ni man. Let's say humpo say when you be 10 years, 15 years na akoye bibi oho na fe ye do call hospitals akese me ebi so anka ukọ koye check up ntem na nke ye hu ni ntem a ke so ano ntem anka anko jinsem in the regular checkups there ebusuafo ehu hia na ya kan say no yemfa aseda emma environmental health and sanitation Capecoast Metropolitan Assembly omone commander Edina Egwafo Abrem municipality omo enomaso ya sina enume health check jumedie yede bro mamenka also say ubehu ye wo digital channel no so 514
obesanso ahweye ewo Facebook ene YouTube nyina Coastaltv Capecoast obetimi adjoin ye na oni atwetwe enkomo ene enkomo no eye cervical cancer na cervical cancer say afei na waben wafidie na enkomo a enwumre yedi eno no enti no yaka vaccination ho asem no na me pese me hu say hwan mo no mo ye eligible hwan mo no mo qualify say ye betimi amomo vaccination.
Okay, so about vaccination currently no you started with aged 9 to 14.
Okay.
You started with them, and I think up to 45 years. Yes, you can take the vaccine. But before we say 9 to 14 a year, is believed say infection or monia infection is believed say a transient. Certain make an infection about the body is able to clear it.
Yeah.
Into you believe that depending as the person is growing, the body clears the infection. So we are giving the infection the vaccine to them so that they will not be exposed to HPV,
Okay.
and a human papilloma virus, Into so person you vaccinating wa obeba hospital.
Okay.
Na you screening will be screened before, and then you screen SHBI fine, and then we give you the vaccine.
Okay, now in paying for
me aba.
Okay.
I think so 45 years. Yes, me aba.
Okay.
For them to be vaccinated.
Okay. The infant say maybe 50 years. May I call from akola teenage to up to now but me vaccination ni bida and no special care bi wo homa me ana.
Okay, into baba for screening. It says that me kind no baba for screening. You be screening with all into yours will be regular screening.
Okay.
Regular screening. So yours will be regular screening. Ubana say everything is okay. Na ya show yes. Number of years are obesan aba. Na ya san show.
Okay.
So we have to track you with that.
Oh. Okay. Now what kasa no o say we are not just say bibi amuguso yes ana
that is
Capecoast Metropolitan Hospital.
Yes, mpacho ye hono so ye bi.
Okay.
Nti mse no moko schools ne mo nso ekoye those between the age of 9 and 14. For them to take the vaccine. Okay. And they are giving it to them at an early stage.
Okay.
So that we are also trying to achieve herd immunity such that enough people will be immune to the HPV.
Okay.
So that the transmission will be very, very low.
Okay. Okay. Let's just say I chinampo me imagine say me ba Capecoast Metropolitan Hospital ubetimi aya mame.
Me pacho an.
Okay. And no free and I say me.
Pacho enye free.
Okay.
Vaccine dey enye free.
Vaccine enye free but screening no so.
Screening no so enye free.
Okay.
The screening is so I think it depending on hospital bia.
Oh.
But the vaccine no enye free. Uyebenya amawa I think between 800 to 1,000 Ghana cedis just for one. So enye free. Screening also so it depends on the facility that you are going to.
Okay.
Obiya on your board, then you come and then we help you.
Oh, okay. Now assembly a wokan na me pese yesanso esisubiem. You listed a whole lot of preventive measures to the cervical cancer. However, statistics are Ghana has say yankasa no say cervical cancer no it affects thousands of women every year, and most of them actually lose their lives because of cervical cancer.
Yes.
Why is it so? Because preventive measures are there and education is also ongoing. However, it's still affecting people and people are still dying. Why?
So that is why we spoke about the secondary prevention.
Okay.
So with the secondary prevention is the screening. When you are not screened, like I said, you don't who say this person has the virus, this person or HPV. So the screening helps us to detect the precancerous cells. You know, so when a screen yet to me screening, na say who say lesions be service ne so yet to me someone so that it doesn't progress to cervical cancer. But if you are not screening regularly, if you are not coming for regular screenings, because vaccination because say I did no boy I cannot afford. So the ideal thing is that you come and you are screened regularly. You shall date say, okay, your screening will be in your so after 3 years you would screen again. After 3 years, you make sure that you come for the screening. Into 1 year, that is where, you know, whatever that happens, we are not able to see it unless you come to the facility, unless you go to the hospital for you to be screened. Into regular screening is something that we are so loud about. Say, because the infection is very persistent. Into one bam, you know, to the extent we cannot help. That is why it happens. So, into regular screening is something that yes.
Yebesa ba hobie me wasamba kwa mpesa mi bisa na ansa na no mami sanka wo se ubetimi ajoin ne ewo studio ha say na o questions a wo no odi aba na contribution bi so ha o pesa wo de ma ubetimi so e de aba e bia na woni mo bia wanya cervical cancer da ana say bia wan kasa mpo ubetimi ene ya share wo experience number no 0508206846 Mami nsi subiem 0508206846 eno ne number obetimi afre na woni ye atwetwe enkomo na health check jumede so bi ensanso emfa aseda emfa Capecoast Metropolitan Assembly Environmental Health and Sanitation and na commander Edina Egwafo Abrem na omomoa eno nti ena enwumre yetimi atena sia ye health check Coastaltv so ye de bro na Miss Kezia ye babe sorry so anisa baby eju no anka meka say o last words bia na emom no me pese usanso esi suma ebiem say me babe ye screening na say mini cervical cancer na e de na mo betimi aya aboa me na say me be yesu na say virus ni bi e wo mini pedua mu a emoa ben and I'm betimi di aboa me as health professionals.
Inti medawas. Inti oba na say emi say meka say na meka say screening methods ni wa hodo bi sa. Inti e bia oba obuka say me pese me ye VIA ana me pese me ye pap smear ana say HPV DNA testing. Inti oba na say ye hwe na say oye bibia ye fine na ya hye da foforo. So if you have a pap no, I said BBI fine. You sample na collab. Yeah, VI no so amount. BBI negative. Everything is fine. After 3 years, now we're back. Until you would go home and come back after 3 years for rescreening. Until you be doing regular screenings for someone who is not having the HPV virus, and I said BBI kama. Results, no, everything is normal. Your pap, everything is fine. You would rescreen. We don't leave you say there is nothing BBI anywhere to go. And then we don't hear from you again. No. So we encourage that you do it regularly. Good. Now obi soba na say our virus ni bi. Your advanced care yedema nipa no so we encourage that do sample collab ebi abase positive ebi mo ho they are even close, they are just a step closer to cervical cancer no. So with that one yetumi so say your cervix your treatment methods ewo ho and it differs. You were ablative and excision. You can't ablative now. We that use ice and heat. Ice block, yeah. And ice block, but mechanic say gas. Gas carbon dioxide and I say nitrous oxide. So it appears say when you are treating the energy it gives you, it produces that freezing wave. So we freeze the lesions on the cervix. So when you freeze them, when nipa no coffee or for review, but say the lesion it falls off, the place heals back. Now oban so na say your cervix you are a step closer to the cervical cancer. Pap naba. It's not good at all. The doctor can decide. We will refer you to the doctor. Say, okay, with cervix, we have to take out a portion now a costly issue, no? Okay. If an excision, so we have to excise the whole thing out. Oh, I will say you free hole, and you free one, so it goes back.
Oh, and yes, and Papa.
Yes, it goes back. So that one, your amount of restrictions. If you don't have sex, you know, after the procedure, let's say for 4 weeks, there are a whole lot of. So Uba will counsel you before any treatment is given. Into Uba, said there's an issue, we take it from there and then we help you.
Okay. Now, yeah, can you say no? So I make send a meeting. Can I say no? Say nyaka bibi to say breast cancer, cervical cancer. Na me man you mu afim. As a man no kwan enyo mo asem mo mfa. When na ye hu say virus no it meet na member mu so it meet do omunya no advice afuto be na de be member no. So how should they get involved in creating awareness and prevention all these things?
Okay, so we have abstinence and when you should be faithful to the person. Okay. And then there's also condom. Condom is not entirely safe, but it will protect the because the scrotum no so virus no to me baby.
Okay, it's me affected scrotum no so.
My patron. It's me It is not, but we encourage that. Okay. Say panel na akobane say okay, this is what we are doing. We advise that you use a condom. They can also come to the facility. Now they will be assessed. Now sure because the transmission is vice versa. Okay. They can equally give it to the female can equally give it to them. Yes. Okay.
Susana now remember no so also I bring your baby omba for screening near there.
I was almost so omoba, but almost I guess omoba for screen omo hospital no. Obi say obi betimi akọ treat no obi baba no akọ treat na you know another person edison their money biom. So they should also come, especially if it's a couple. Because now what you see the pakwan say when na mini ni share and I ko ba na sa. So you just have to come to the hospital. Yeah, sure.
Ade na nkasa de anka be ya anka yentwe ye ho emfiri mpomu agron especially say won ware ya anaso say we ya kola diwa nkola agro men konkodi mpanyimfo agro ma enkofa we nyina emfa mbro but o hwe so na say won dimi insha won so a na wabomode ama wo partner no AUC protection to say condom ya ye kan ho asemi na so so abeni abebia no ukọ hospital no wakọ check up ni ade screening ni ade nyina se na ebe ya bibi sa wo hompo na ye beso anu ntem ansa na age nsem ebusuafo ye bre no enya ye bre nanso no ye da so wo ha ya ye nko ye de se 6846 eswa ye no ebedi nkomo fefefe na wonso one ya che wadwenche bia owo ye de asida ebema Capecoast Metropolitan Assembly omone commended na egwafo abrim se omaso ya sen ema eneso ye de health check jumedie e de abro ma menka wo se channel no eye 514 digital channel no eye 514 obehu ye so ewo Facebook ene YouTube na ye wie krampo na obetimi akọ hostel na wakọ akọhwe nkomo na ye di ye ni bi se na be ya wonso obetimi ede etu hofo ene nkomo no ye twetwefa cervical cancer ehun last week se na meka ye no ye kan breast cancer ene ya kan cervical cancer ni nyina mu nso no mpanyimfo ana se nimdiefo no ama ye hu se enye emma nko anenya emema enso ka ho bi nti se wo ye papa wo ye enuabema wo ye okunu boyfriend fiancé bomodin na wonso abani abebia no ye check up na say ye screening ni ade na say oho partner no so na say wunua no ebusuani no shenin crime so no so onko hospital abani abebia na onko hwehwe nimpom na apomudin de me say sika entimi nto ai wo sika dan mampo na say yare ba na ba ai sika ntimi nto apomudin wo apomudin na wo ade nyina obetimi so atena asase so ache sani obia ehwehwe no midin asa wo de frame a meje wo so baabia ni abrebia eye Afiba health check jumedie na ye de abro Coastaltv your own face your own voice ye bekramo na dasene ebesanso enemo edi ehia biem ma mensanso emfa aseda emma Kezia Annan or your senior staff midwife or Capecoast Metropolitan Hospital say anyway waba cancer. Miss Kezia say be person won share obi ansana ya sorry so.
Okay.